Welcome to the Voice of Many podcast show with Yolanda and Vanessa.
Good evening, everyone. Thank you for joining us. Our podcast would not be possible without you and our sponsor, Z Funk Productions. This afternoon, we have a very special guest with us. We have a doctor in the house. So just stay tuned and more is to follow. As we stated, our guest today is Dr. Mike. Dr. Mike Wasylik. I know I didn't say that quite right, but good evening, Dr. Mike, and thank you for joining us.
Good evening.
Oh, would you please tell our listeners a little bit about yourself and where you're located?
Well, I'm from Tampa. I've been here 42 years. I've practiced orthopedic surgery in Tampa, mostly at the main hospital, St. Joseph's. And I basically have finished practicing and I'm retired now.
Okay, good.
Can you tell us about who's inspired you throughout your career?
I would think that the biggest inspiration I had, I have to go way back. I am as many people in this country, I'm a product of immigrant parents. And they came to this country and basically held menial jobs so that their children and grandchildren could do better than they did. And my father had no education. My mother had to quit work in the 8th grade. Her father died of black lung.
Wow.
When she was in the 8th grade, and they had like 9 children. My mother was like third from the top, so she had to drop out of school and work in a shirt factory. And she's a real inspiration to me because when she was little, she picked cotton. And when she was older, she worked in a shirt factory. And the interesting thing that I found out recently was that her older brother was upset with her. And he was a good guy. I don't mean to not say good things about him. But she, at that time, I believe it was in the 40s, or no, earlier than that, was making $5 a day, which was an enormous amount of money. And she was making more than he was working in the coal mines.
Wow.
So he got upset and he quit the coal mines and went to Detroit where he got a job in the automobile industry. So, but the question was, is who inspired me? Well, my oldest brother, I had a brother, I was like the baby of the family, and my brother was many years older than I was. And I was probably 7 or 8 years old when he was drafted to go to Korea. And I tried to stop him from going, but obviously I couldn't do that. He was there 1 year, and he came back. He was a machine gunner, and he never talked about the war at all, as many folks who are veterans will not. Yeah, he came back, I found out recently, he had 2 Bronze Stars and a unit citation. But when he came back, he wrote letters to all of his colleagues who were in the military, and the letters all came back that they were deceased.
Oh.
Apparently one week after he left, the Chinese, and if you read, there's a good book, Frozen Hours, and the Chinese would, with guns and bayonets, would go up the mountains, and if they survived, they would kill everybody. So everybody in my brother's company was killed 1 week after he left. So he always had the survivor's remorse. But anyway, he was the first person in my family to finish high school. And then because of the Korean War, he went off to college and had 8 years. He was an optometrist. And it was because of his leadership that it was expected I would just do something. We didn't have any money, so it was, I had great parents that just said, we can't help you, but you can do anything you want to do. So back in those days, I found jobs that I had that I was able to work my way through undergraduate and 4 years of medical school and come out without any debt, which is unheard of these days. But the tuition was cheaper, and the jobs are available, which the jobs I did are not available anymore. So I don't know what I'd probably have to borrow my way through like all these other unfortunate students do. But that was my brother was my real inspiration. And then after that, there's so many people that, that I've come in contact with, really good doctors who have, like Davis Bowling here in Tampa, who's passed away. He was really a quality doctor, and he's just a good guy, very honest guy, and just always did the right thing for patients. And during the residency, I was fortunate enough to come in contact with some of the really great teachers. I had a really great spine surgeon, a guy named Henry Bowman. The head of our program was a guy named Charlie Herndon. He'd done a lot of the children's work. So I've been a very lucky person and very fortunate to get the training I've got. I remember leaving high school and looking back at the school, and I was on the other side of opportunity. And I didn't know what would happen to me, how I'd get through school, and again, a very lucky person. All my dreams have been fulfilled.
Wow.
Can you tell us how the virus, COVID-19, has impacted your life?
I think it's affected everybody. In my life, it has. My wife has developed dementia, and she's in a home for dementia. And we had never been apart over 6 days in 51 years.
Wow.
And we were, obviously, I wasn't able to see her for months, although I could call her, and I did call her every day. And so that was the problem, although I think that I'm grateful for it. It's very difficult for the folks, the leaders, the governors, to do what they do, because this was so different than anything we've seen in the past. And the shutdown for the nursing home was the thing to do. And I recently saw the governor on, I believe it was, on the Levin show on Saturday night. I was very impressed at how much work he put into all his decisions. And he talked about the nursing homes, which obviously are significant to me. And he realized that families weren't seeing their loved ones.
Mm-hmm. And
so he developed a couple focus groups, and he's set it up now. I've been tested negative, and they practically put me in a hazmat suit, but at least I'm able to go and see my wife, again. And so that was the hardest thing for me. Other than that, as a physician, this was not that big a deal. I mean, physicians and nurses, God bless our nurses, are used to taking risks all the time. So it never really bothered me that much. I wear a mask. It's been really hard, I think, on everybody. I've never seen anything like this. And a lot of the stuff we're getting, probably because nobody knew what they were dealing with, is so difficult. I mean, wear a mask, don't wear a mask, shut down, don't shut down. There's just been a lot of conflicting advice. It's sort of like the weather. You wait 15 minutes and it changes. So everybody's confused. There's a lot of politics involved. There's a lot of fear involved. And so this is an unusual period in our history, and I'm hoping that we'll get through it in the next few months. The shutdowns need to be in my opinion, need to be very targeted. They need to be targeted to nursing homes and to high-risk patients. And if you do a shutdown other than that, all you're doing is delaying the inevitable. Eventually, it's going to go away when we get herd immunity. and which is basically enough people have been exposed to have antibodies that there's no place for the infection to go. If we have a vaccine, that will help out because that adds to herd immunity as it does with the flu. But yeah, I think as everybody, it's affected me somewhat, and but mostly on a personal basis.
Okay. So I know you said you and your wife had not been apart in the longest part was 6 days. So can you tell us when and where did you meet your wife?
Well, it's a typical story. I was a physician, or I was an intern at the time, and she was a nurse. And the story is that I found her very attractive, and I went to ask her out, and I thought she sort of rebuffed me. And so I just, walked away. And then, as fate will have it, I was driving to the hospital maybe the next week, and I saw her get up on a bus and walk down the center aisle of the bus. And I thought, gee, that's a very, very pretty lady. I need to give her another chance. And it turned out she was quite interested, just was shy. And so we started dating, and I think that was, we've been together ever since.
Oh, that's so nice. So now you said you've been married 51
years. Actually, last October 4th.
Wow.
Mm-hmm.
Well, happy belated wedding anniversary to you.
Anniversary.
Oh, man.
I went to her room and I fed her hospital food. It used to be we would celebrate by having lobster and champagne, and she had some cafeteria food with apple juice.
Oh, I'm sure that being together, made it all worthwhile. Still,
Mm-hmm.
That's good.
But do you think it's the key to a successful marriage? That you and your wife have had a great marriage, it seems like.
Yeah, I think we have had. The key, I think, very strongly, and it's what I advise younger people, is that you need to be in love with the person you marry, but they need to be in love with you also. Mm-hmm. It's got to be a two-way street. Mm-hmm. If you've only got love going one way, it's not going to work out. And so the only reason to get married, in my opinion, is if the person you love loves you as much, and you look at them and they're more important to you than you are.
It's very, very deep. That's very good. Very good. So, I hear, as you know, we have a very strong source, that you still have a mean swing when it comes to the golf club.
No, I don't. I don't know where you got that. I'm actually a tennis player, and I'm a tennis player because when everybody else was doing sports, I was working to work my way through school. So I didn't start athletics until I was in my 30s. And I did become a decent tennis player, not a good one, but a decent one. I had surgery, and the results of the surgery were a paralysis of 2 nerves in my right arm, which really led to my retirement from practice. And also, I can't raise my arm up so I can play tennis. Mm. The nice thing about golf is that you only need one arm. So I can play golf with one arm, and I can hit it far enough that, and I'm old enough that I almost hit from the children's tees, so that the fact I don't hit it so far anymore doesn't matter. So I can play golf. I would rather play tennis, but I'm a year away from that probably.
Oh. You still have so much youth in you. I'm going to say youth because you're very active, very active.
Well, I've been active my whole life. I started working degunking Jeeps when I was 12 years old. Again, that's a job you couldn't do anymore, and maybe you shouldn't. And I didn't realize, because I never looked back, that I really worked for 65 years, probably at least 50 hours a week. And it wasn't until I sort of shut down my practice that I realized that. And so this past year, since of my practice been shut down, I've had, time to myself, which I never had before. But, the time, the needs or the work expands to meet the time allotted between the time I needed for sharing and, doing other things. I'm more busy than I thought I would be, and it hasn't been. Retirement is an evil word in my family. We consider it a cuss word. And, but it hasn't been as bad as I thought it would be. It's been okay.
Okay. Now, can you please give a few words of wisdom and encouragement to our listeners who, one, are thinking about going into the medical field, two, that are thinking about jumping the broom? COVID has changed a lot of plans for people. Many marriages had to be rescheduled. So, and then you have couples nowadays that are having to stay in together when they're used to just seeing each other in passing. So you have any words of encouragement that you would like to pass on to our listeners?
Well, there's three questions there. You asked about going in the medical field, and I can't think of any better place to be. I mean, it's just, it's a gift to be able to be a physician or a nurse and to take care of people. There's no greater calling, in my opinion. I'm a little biased, but I encourage people to go into medicine. I think it's a great field. You can do so much good. And like I say, it's a gift to be able to do so. The marriages, that's interesting because I have a nephew that was going to get married in Toronto. He's got a really lovely, his fiance is just a lovely lady. And, but they can't go across the border. So, marriage, as many people have, marriages have evolved, from what I'm aware of, have become less frequent. There's more justice of peace, and they're being delayed, or they're much smaller. Mm-hmm. So, and the third thing is, the thing about the problems with how it affects you at home, I just don't think you can be governed by fear. You can be concerned and do things appropriately. I mean, I don't fear the virus, and yet at my age, might not survive it. And but I wear a mask, although I'm not sure a mask is of any value. It is for large particles. There was a recent CDC study that came out where 75% of the people who developed the virus ended up were wearing masks full time. And the reason for that is that the masks are good for large particles, and small particles will go through a mask. I wore a mask the whole life because I'm a surgeon, and but I wore the mask to protect my patients from me, so that I wouldn't infect them. And when I had more high-risk procedures, we would wear what is the equivalent of a hazmat suit, where we're actually inside a suit that has a vacuum so that nothing would fall on a patient. There's no skin, no particles of skin, no bacteria. And that's really the only thing that can really protect people. I remember when AIDS came out, AIDS initially was a death sentence. And we had to take care of patients with AIDS, and we would wear a hazmat suit. So if I knew someone had AIDS, that was great because I could take the necessary precautions. There was a lady doctor, and I forget her name, in San Francisco. San Francisco had a large gay community, so the AIDS was at that time associated somewhat with homosexuality, and then initially. And she didn't know. She wore a hazmat suit with every procedure she did because she never knew who had AIDS and who didn't. Mm. And like I say, way back when it started, it was a death sentence. And now it's, medicine really moves on. I think that we've learned so much about this virus, and the treatment of it is getting better. what the president went through. Not everybody's going to get what he gets. Obviously, the antibody is a reasonable thing to do, and he got the antibody cocktail, but there are medicines coming out that should be around shortly that are going to reduce the inflammatory response, which is usually what ends up harming people, especially in the lungs. And vaccines will come out, and if they are effective, they'll help us get to herd immunity. And then, I don't know if I always remember when we get the flu every year in my office. One of my staff would get the flu, and then another one would get it. They would just go around the room till we all got it, and after we all got it, we were fine. We did fine for a year. Again, this is a different virus. It's you don't know exactly what the history of this will be, but I'm really hopeful that we'll get it under control in the next couple of months.
I hope so too. I really do. But Dr. Mike, thank you so much for being with us, for sharing, for providing us with a lot of knowledge and education. Thank you so much. It's been a pleasure to finally have some time to talk with you.
Okay. Thank you. Good night.
Good night.
And to our listeners, thank you for listening to the Voice of Many podcast. If you have any questions or suggestions, please contact us on our many social media web pages. Please don't forget to subscribe to our channel, and we hope to talk to you later.